Great. Well, thank you so much. Thank you, everybody, for joining us tonight. And today we're going to talk about how we can help children maintain emotional health and well-being, and also recognize signs of anxiety and depression. Just a little bit of information, as Marcia mentioned, I work at Capital Health Behavioral Health, and we are in Bordentown as well as in Newtown. We treat children, adults, older adults in medication management, as well as individual therapy and group therapy, assessment, and testing as well. So what we're going to cover tonight is really talking a little bit about emotions during childhood and adolescence. I'll be focused on kind of childhood. I'm not going to get too detailed into younger children, really elementary age to through adolescence. We're going to talk about kind of typical emotional development, as well as anxiety disorders, depressive disorders, the impact that bullying has on depression and anxiety, the impact of social media and screens, and really how to help support, our kids. I also should mention I have a 11-year-old and an 8-year-old. I have an 11-year-old son and an 8-year-old daughter. So this topic is very important to me as well personally. And also, of course, taking care of ourselves as parents, because without that, we cannot support our kids effectively. So to start out with, just what does emotional health look like? Really, a kind of a general definition of emotional health is the ability to understand, express, and manage emotions, to cope with challenging situations, and to build resilience and positive relationships. And this really does start in childhood, and this is something that, the next bullet point I say with, I just want my child to be happy. I think we've all said that, or I've said that. We hear it all the time. Our emotional health is very important in terms of our kids' emotional health. But the problem with I just want my child to be happy is there's a very unrealistic expectation. Of course, nobody can be happy all the time. We want our children to experience happiness, of course, as much as possible, and joy and all the positive emotions. But by just kind of focusing on that, we are kind of limiting really the full experience of having all different kinds of emotions and being able to manage and cope with those emotions. And these are things that need to be learned. We are not born understanding how to manage emotions. There are skills that need to be practiced, that need to be tried out, that need to be modeled. So, as early as we can start with kids, I think it's important to kind of start helping teach those emotion regulation skills, teach distress tolerance skills, teaching communication skills, having a language around emotions is really important. And I think children now are starting to have that earlier. Certainly, I didn't feel it when I was young that there was really a lot of discussion around, our emotions and having a relationship to our feelings and that kind of thing. So I think by starting that early and modeling some of these skills, and I'll get into them later on more specifically, we really can help kind of equip our kids so that they can cope with the range of emotions, not just kind of look to be happy and then, try to avoid all these other emotions that are inevitable. During childhood, and then especially during adolescence, peer relationships become very central, right? So that kids begin to rely on their peers and step out a little bit often from the family setting in terms of what is kind of central in their life. They're kind of trying out separation and individuation with their caretakers, right? So caregivers. So they're trying out their own independence. And with this is going to be, big emotions, trying and experiencing different kinds of emotions and trying to manage those. Sensation seeking novelty, these are all very normal experiences for children and especially adolescents. And so really trying to arm our children with ways to manage and kind of cope, we can help them through these ups and downs of normal childhood development, of normal, the ride the wave of adolescence a little easier. And that really starts out with a foundation of kind of positive routines of sleeping, eating, self-care routines, because in order to be able to manage emotionally, we really have to have a foundation of these things. So I always kind of come back to those real basic needs. If things are, when looking to start to kind of help with the emotions, these basic things need to also be in place. A little bit about what causes, when those normal kind of a big emotions and the kind of normal waves of ups and downs in childhood and adolescence become more significant and meet criteria for anxiety and depression. What kind of happens? Where does that, what kind of leads to that? And of course, like most things, it's not one thing. It's a kind of a multifaceted result, right? So there's a genetic predisposition. So certain genes may increase an individual's susceptibility, family history. Certain types of temperaments have been shown to predispose some to anxiety and depression. So for example, behavioral inhibition, those kids with a temperament that tends to kind of result in withdrawing from novel people, novel situations, they may be more at risk for developing anxiety disorders. Neuroticism or a negative affectivity is a type of, an element of a temperament that where children feel negative emotions very deeply. They're very sensitive to that. So those also, having those types of temperaments may predispose one to experiencing depression and anxiety. And then, of course, environmental factors, stressful life events, trauma, abuse, loss, major life changes are going to impact and predispose one for anxiety and depression. Imbalances in neurotransmitters, such as serotonin, has also been shown to impact one's risk for anxiety and depression in the future. And then, of course, there's, medical conditions and also side effects of medications can contribute to increased anxiety and depression. I think, most have agreed that there's been a real increase in many different types of psychiatric, diagnoses, but especially with depression and anxiety in the last few years. This is not completely updated, but you can just see these different groups or different colors. Hopefully you can kind of see this. Different groups have all been shown to have increased rates of depression and anxiety, feelings of hopelessness, substance use disorders, suicidal ideation, attempted suicide. And, I think, of course, like most things, there's many reasons for this. There's not one reason to point to. You can see this was the highest rates here, 2021. So the pandemic, as we know, was a really difficult time for all of us, but especially for our kids and teenagers. There was a lot of social isolation. There was a lot of fear. And that clearly has played a role in increasing depressive and anxiety symptoms. I think it's clear kids are under a lot more pressure these days. There's a lot more stimulation. Their schedules are often overloaded. We're seeing perfectionism earlier and earlier in children. And of course, their parents are stressed. So people in general are experiencing more anxiety. And so that obviously is going to impact the way children cope as well. So moving forward to anxiety disorders, approximately 10 to 20% of children through adolescence are diagnosed with an anxiety disorder. Along with ADHD, this is the most common kind of psychiatric disorder that children are diagnosed with. And the most common in children are generalized anxiety disorder, social anxiety disorder, and separation anxiety disorder. We hear the word anxiety all the time. Our kids know the word anxiety. I think it's really important to know that, there is a spectrum. I mean, everyday kind of stress and anxiety is a human experience. There's nothing pathological around it or about it. And in fact, anxiety can be quite informative and helpful at times, right? But I think it's about understanding when it becomes an issue that is interfering with one's daily life, when it's prolonged, when it seems that the symptoms are really not matching what our child was like, their personality beforehand, if there's a sudden shift. Those are the things that are important to really look for. Because, for example, worrying about, this is for adults, but paying bills or a test, these, at school or other life events, that's a very normal experience. But if you're finding that your child is kind of constantly worrying about, unsubstantiated things that really aren't an actual, aren't really coming an actual threat, they might be exhibiting more symptoms of generalized anxiety disorder. If, embarrassment, being self-conscious, avoiding a social situation now and then is very normal. But if you're kind of avoiding social situations for fear of being judged, or humiliated, and it's becoming a pattern, that might be meeting criteria for social anxiety disorder. Everybody's experienced a case of nerves or, sweating before a test or a presentation or a performance, which is of course very normal. But if you're feeling that you're worried about having out of the blue panic attacks, for example, or you're very preoccupied or fearful of having one, then that might be more panic disorder. And again, these ones on the right would then require kind of further evaluation and possible treatment. A realistic fear of some sort of dangerous object, place, or situation is very, very normal. But if that fear is irrational and there's such avoidance of that object where there's really no threat, it may be a phobia that your child is experiencing. And then, of course, anxiety, sadness, difficulty after some sort of event that's happened or life change or traumatic event is very, very normal. But if that kind of leads to recurring nightmares, flashbacks, numbing after the event, then that might be signs of PTSD. So again, this is a kind of a range and a spectrum, and really what we want to rely on is, you as if the parents out there, your children, that if there's been a sudden shift, if they're not kind of, if they're these symptoms are not consistent with them, or something new is happening, or they're getting so significant that they're interfering with their daily functioning, then it definitely is time to get an evaluation and possible treatment going forward. Aside from those kind of classic signs of anxiety, I think for kids and teens, there's also some others that can show up. Avoidance is a big one. Excessive need for reassurance. This may be, worrying about, uncertainty about the future. Excessive physical complaints, right? Both depression and anxiety can really manifest physically. And sometimes for some children, this might be where how their anxiety is expressed. It may even feel more comfortable for them to express their distress in that way, in the physical way too. Sleep disturbances is a very significant kind of symptom as well. Of course, concentration and attention, perfectionism, as I mentioned, those what if questions, really worrying about the future. Of course, if they are kind of, if they have many absences from school or their other activities, if they seem more easily distressed than usual, even lying, it can also be a sign. Now, of course, looking at these, one would look and say, of course, all teenagers and children kind of experience all of these. So it is really difficult, I know, to kind of know where that line is. And of course, if you ever have any doubt, it's always best to go to a professional and really get a full picture, because if you have any doubt that these symptoms are turning, or these kind of experiences are turning into symptoms that are interfering. I wanted to talk a little bit about the overlap between ADHD and anxiety, because as you can see, there's a lot of overlap. And they also often are comorbidly experienced, right? So many kids who are experiencing anxiety will have ADHD and vice versa. So you can see the similarities in terms of attention and distraction, fidgeting, disorganization, poor time management. If a child is experiencing a ton of anxiety, it's going to kind of take up a lot of their resources, and that's going to interfere with some of their behaviors, right? It's going to affect their ability to learn, to concentrate, to remember, to plan. And so some of these things may look very similar. But there are differences, as you can see, that are typically seen with one or the other. So ADHD, typically there's more impulsivity than with anxiety. There's more maybe outward outbursts. There's often a description that kids have of they're having too many thoughts. They may be more sensitive than usual. And remember, these are experiences or symptoms that they're having across settings, right? Both at home and at school. And they may struggle with these symptoms even when they're doing things that they like to do, right? So that's something to keep in mind. So moving forward to depression, so with depression, the kind of classic symptoms are, of course, we know feeling sad or having loss of interest in things we used to enjoy, right? But it also, in addition, is going to impact our sense of self-worth. Usually things like sleep and our appetite is going to be impacted. Again, it can manifest physically for children especially too. Digestive problems, trouble focusing and making decisions, restlessness, or the opposite, almost a feeling slow, like you're moving through quicksand, a more pessimistic outlook. And again, irritability can often show up as a symptom of depression. And of course, any suicidal thoughts, hopelessness, feeling, that you don't want to live any longer. So obviously suicidal thoughts or attempts. And other ways depression can show up for kids is an increased complaint of boredom. And again, all kids complain of this, but really this is in conjunction with some of those other symptoms and maybe something that is really kind of paralyzing your child from their daily functioning. Physical complaints, as I said, isolation, withdrawing, a real shift in a change of friendship groups in terms of or kind of pulling away from friends, a change in their grades, or interest in activities that they used to be interested in, a sense of feeling flat, of feeling numb, not really feeling sad, but not really feeling joy either. And that kind of feeling of, a sense of helplessness. So all of these things, again, if they are kind of so significant that they're really interfering, then it's really necessary to kind of get further evaluation and treatment. And again, with all of these, the good news is while even though anxiety and depression is increased and kids are experiencing it younger, we do have effective treatments, for children, and there are different types of treatments. It's not just medication, for example. There are a lot of different ways to help our kids get through this. I want to mention bipolar disorder or mania because even though it's rare, it's more rarely seen than depression and anxiety. It is, I think, something to be aware of, and also, and just kind of understand what the symptoms are of mania. So, if your child is having these, experiences of depression, and then also periods of feeling overly elated, for example, for a long period of time, or talking very quickly, racing thoughts, not needing a lot of sleep, for example, again, becoming easily distracted if that's not typical, an overconfidence in abilities, and again, engaging in risky behaviors. So this type of episode might occur with mania and then followed by a depressive episode. So again, any of these signs, and you want to make sure you get further treatment. In terms of talking about kind of the impact of bullying on depression and anxiety, one definition is the intentional hurting of one person or a group by another person or group, where the relationship involves an imbalance of power. So this is very different than just conflict. And I think, I think our schools are doing a good job of kind of bringing this issue up and having, a lot of discussions around it, mission statements around it, and consequences around it. But, a conflict is not one-sided, right, necessarily. With bullying, the goal is to hurt or humiliate another or another group, and that the behavior continues even when the person or the group knows that they are causing harm. It can be physical, it can be verbal, it can be psychological, it can be face-to-face or online, as we know. And at least 19% of students grades 6 through 12 are experiencing bullying. It is probably much more than that. But we know there's a really strong relationship between bullying and depression. The risk of depression is 2 to 3 times higher in those who have been bullied. The risk of depression is 1 to 2 times higher in those who bully. So it's also affecting the kids who are bullying. And it's 3 to 4 times higher in those who have been bullied and who bully, right? So those are that group is most at risk for depression. Just wanted to talk a little bit about what we do when if our kids come to us about bullying, right? I think whenever our child comes to us, even with the best intentions, we are often trying to rush them out of the feeling or minimize it or fix it, right? That's kind of what our instincts are often to do. We want to fix the problem. We want to get our child out of pain or suffering. So it's a very human, normal reaction. The problem with that, though, is that, if we're only taking our child out of the problem and kind of fixing it for them, we're not really helping them with those skills that I'm going to get into soon in terms of, managing the difficult emotions that go along with these challenges, and helping them to look inward and see what they can do, what they can practice to help themselves. And also, so we're not teaching them, right, if we're just fixing it. We're also sending them the message, either explicitly or implicitly, that they need us to fix it, that they need, that we need to step in. And really what we're doing then is setting them up to really not know what to do as they get older, right? And not feel confident that they can help themselves or manage a situation or stand up for themselves or even know what they're feeling, right? So it really does start with kind of, helping them, coaching them, as opposed to just fixing the issue. So the main thing when a child comes and tells you that, they're getting bullied or they're getting mistreated, I really think I just always start with the first thing is, I want to reinforce the fact that they're coming to me and talking to me and bringing it up, right? So I right out of the gates want to say, it took a lot of courage to tell me this, or I'm so glad you told me this, right? Because I want them to know that it's always a good idea to share what you're feeling if you have a problem and need help solving it, right? And I'm certainly want to be the one that they feel safe coming to. So starting with that, as opposed to, as you can see on the right side, why are you letting other people get it to you? Kind of, minimizing or invalidating maybe kind of what their distress is. And again, this could be with the best intentions. You're trying to kind of convey to your kid, like, this is not in the scheme of things, it's not a big deal. But unfortunately, when we kind of say that to them, the message we're sending them is, what I'm feeling must not be right, or, well, I guess I can't come to this person and talk to them about it, or I should just ignore what I'm feeling. And when we ignore what we're feeling, that comes, what that translates to later on in life is really not being in touch with what your needs are, what you want, And that's often what, many adults struggle with, right? So it starts early, reinforcing that that they should trust what they are feeling is real to them, right? So I know this is hard for you. You don't deserve to be treated this way. It's not your fault, right? Those are very clear messages we always want to convey to a person, to our child who's feeling bullied. As opposed to really jumping to, oh, what did you do to cause this, right? Looking for some sort of reason. Because again, with bullying, it doesn't necessarily have to be any reason why this behavior is happening, right? So again, reinforcing, I'm always here to listen and help you, as opposed to you shouldn't care what other kids think, right? That's minimizing. This is reinforcing the discussion. How would you like to handle this? Now, this is I also think, a really important distinction, because what we're doing is trying to help empower our kids to be part of the solution rather than, as I said before, going right to, well, I'm going to call the school, or I'm going to call those parents, or, I'm going to fix it. I'm going to fix it. We're kind of, again, supporting and coaching and asking them to think through ways to handle it. And honestly, your kid knows, is more of an expert of the school environment than we are, right? So they actually may have ideas and more realistic ways to handle this. So I think really genuinely going into it with curiosity and saying, what are ideas? Brainstorm with them. What can we do about this? Rather than just kind of, you have to push through, get through it, right? And also asking them, like, who else maybe has their support at school? Do they have friends who have who support them? Rather than necessarily saying you need to fight back and stand up for yourself, right? So again, these are just kind of some scripts that I think can be helpful to keep in mind if this ever comes up. So moving forward to social media and depression and anxiety. So, it's hard. You can't talk about depression and anxiety in kids, or anything with kids, unless you bring up social media and screens. It's a part of their lives. And so we do have to address it. And we know that the more time adolescents and children spend on social media, the higher risk of depression and anxiety. This is probably due to a few different things, right? So social comparison, cyberbullying, having a negative self-perception, fear of missing out, right? These are all kind of thinking states, or some of these things experienced will kind of can be internalized and kind of trigger more depressive or anxiety symptoms. Being on screens, right? And even on social media, even if you have a million friends on it, it is not the same as face-to-face connection, right? It is less connection. It can be fun, it can be entertaining, but it does not take the place of actual connection with others and friendship. And that's important to keep in mind, and important for our kids to keep in mind. And, when they're on their screens, that may take away from other healthy activities, right? So that may also kind of contribute to the increased depression and anxiety. Physical activity is really important. Being out in nature is really important. These are things that are going to protect our kids from depression and anxiety. So if they're constantly on a screen, that's going to obviously take away from that. It does disrupt their concentration and cognition, so it has an effect that way. And it also can cause sleep deprivation if they're, using their devices up in their bedrooms. And especially adolescents, where sleep is so important, and most of them are not getting enough sleep. This can also lead to triggering symptoms of depression and anxiety. But what do we do about it? Because, as I said, even though most of us would probably love to just kind of throw the device out the window and be done with it, that's probably not a realistic approach. Certainly isn't in my house. So what do we do about it? And I really like this kind of analogy of being a coach versus a referee, right? So I am all for, I think everybody kind of, is on board with trying to put off, social media as late as possible, until your child's, as cognitive development is as old as you can. But once they do have it, what is the role we can play? And I really think being a coach, being kind of having them on board with really coming up with the ways in which there are healthy ways to use this and there are unhealthy ways, rather than a referee, which is just just kind of setting up the limits, taking it away, and not really having conversations or an ongoing dialogue about the effects of it. And a two-way dialogue, really, right? We need to talk with them about this. You know, kind of reminding them, obviously, that this can feel very, being on social media, while it seems like it's connecting with your friends, it also can feel very isolating. And really asking them, do they ever feel kind of isolated afterwards? Or how do they feel when they are on these apps or whatever it might be? And really the goal is to kind of reclaim agency and attention versus kind of you know, being on the screen and just kind of really blindly kind of looking through it and not having that agency. So is it a digital pacifier? Is it something that they turn to when they're feeling distressed, when they're feeling bored, when they're feeling any feeling, right? Is that how they're using it? Because I think really being honest about what it is for adults as well, by the way, but you know, what is this doing for us, and being really kind of clear about the role it's playing. How do you feel when you get off of looking at Facebook for 2 hours? Does it feel good? Does it not feel good? And I really genuinely think having conversations coming from a place of real curiosity, not assuming anything. I mean, it may feel good sometimes for them, right? And that's okay. So I think really being curious about their experience, about, and when they what it feels like when they're on it, what it feels like when they can't be on it, and just really working together to figure out what in your family, what makes sense in terms of limits. Um, you know, I think understanding the thinking traps, which can be amplified on social media. So these thinking traps, these are thinking patterns that happen. These are just two of them, like catastrophizing, right? You see something on social media, you see two friends together, and all of a sudden the narrative in your head goes, in a picture, and you start thinking that they're now leaving you out or didn't call you to meet up or whatever it might be. This can get amplified, and you can kind of catastrophize or make things worse in your mind, when it may not be that at all, right? There's a lot of social comparison when we look at social media, right? So these should statements, oh, I wish I should be doing that. A lot of feelings of feeling less than. So all of this makes sense, that all of these feelings, if these kinds of thinking patterns, if you have this, and it's significant enough, it's going to, it's going to trigger depressive feelings, right? It's going to affect your emotional well-being. And so really arming them with that knowledge, and have them do some experiments with themselves about, noting what do I feel like when I've been on this long, or what, and just even teaching them to have a little bit more mindfulness when they're on these screens, I think is going to set them up to at least feel more in control as they get older and feel a little bit more of that agency and attention. So in addition to kind of, in other ways to support their emotional health, as I mentioned, encouraging and modeling them to look inward, to be curious about their feelings, right? To kind of begin to have a relationship to their own feelings. And that can't really start early enough, right? And of course, it's going to shift as they get older and as they shift developmentally. But even encouraging children as young as 2 or 3 to just connect with how they feel inside, right? I mean, what makes them feel happy? What makes them feel sad? Starting that as early as you can will set them up to be able to have that language as they get older, right? Supporting self-trust, right? Trusting their gut, trusting what they feel. I love this. I don't know where I heard this, but I think about it all the time. I had a very shy, one of my children was very, very shy. And my son, and he was my first. So he would always cling to me, always stay close to me, never really wanted to join. And I remember as a new mom, like all I wanted was my kid to just go play, go play, go play, right? But he just took his time and he would kind of wait and then join when he was ready. And somebody told me and just made me shift everything when they said, your son knows when he wants to join. He takes his time and then he joins when he's ready. Fast forward that to when he's 14 and all of his friends are going and doing whatever, right? Some risky thing, or something. And do you want your kid to just join blindlessly then? Then, when he's at that age, we want them to trust their gut. We want them to trust their instincts and maybe not do what everybody else does. But if we don't encourage that when they're young, how are we supposed to expect that when they're in a difficult situation where their peers are doing one thing and they really don't feel comfortable doing it, but they don't, how are we really going to expect them to trust themselves to do what's right for them? So that really kind of reframed things for me about my own anxiety about my child joining and really looking at it like this is actually a really a strength. He knows himself, even at a young age, what he needs when he's ready. So things like that, I really think is, thinking through some of the things that maybe as parents we either overlook or we actually worry about, maybe actual strengths for your kids. Again, offering full attention, right? Being present with your kid, that's going to model for them that, connecting with other people is a priority. It's good for our health, and it's necessary, right? And the best way to get our kids to do that is to do it ourselves. We can lecture all we want, but they are really going to model what we do, right? So amplifying positive moments, having them stop and notice what they feel like again when there's a happy moment going on, when there's not a happy moment going on, just getting them used to really reflecting that way. Give them chances to work through challenges, as I mentioned. There can be a desire to get them out of suffering really quickly, or even shelter them from it. But really, that's doing your child a disservice. We need to help support them, and let them try and fail. Let those consequences happen so that they can figure out what works for them. Modeling emotional health, not perfection. I really think it can be helpful, especially with younger children. I find, talk out loud when you're trying to cope with something. If you're, wake up one day, don't really feel like going to work, but you've got to kind of muster up the energy to go, or you've got to kind of think about something you're looking forward to. Those are all coping strategies. I find kids love to hear when you're doing it for yourself. They're much more, again, they're going to listen to that more than if you're just directly telling them what to do. So walk them through your process of coping with a difficult challenge. And then again, those basic kind of healthy sleep habits, physical activity, self-care are so important. I'm going to move quickly. I realize I'm moving too slowly here. So a few some examples of those skills that I keep talking about that are so important to practice, like anything else, right? Emotion regulation and mindfulness, right? This allows you to have a relationship with your emotions rather than feel that you are your emotions. It gives you a little bit of distance, right? It can help you see and observe your experience rather than be reflexively in it. So grounding techniques. One simple one is the 3-3-3 rule that maybe you've heard of, which again, you start to, if someone's feeling overwhelmed, anxious, nervous, a little bit, they're having kind of their poor attention, they can look around the room and name 3 things they see, 3 things they hear, and 3 things that they can feel, right? These are simple techniques to bring you back to the present. These work with adults, they work with children, and there's so many different techniques out there. Deep breathing exercises, riding the wave of emotions, knowing that emotions are not constant, right? We experience them, and sometimes they are big emotions, but that they will change, right? They don't stay the same. And learning to ride through them, ride over the wave a little bit. Distress tolerance, frustration tolerance is really important. Kids need to practice that, right? Again, they're not born being good at frustration. That doesn't, they have to practice it. So there's different strategies. Tip is one of them that, where if they're feeling completely overwhelmed, it can often be helpful to change the temperature. Maybe it's going outside, right? Getting some fresh air. Distress tolerance skills are all about not making a situation worse, right? It may not mean that you can solve the problem in that moment, but there's certain things we can do to lower the volume, to be able to manage, to cope, and not make things worse. And these are some of those types of strategies. Exercise is always good. Getting into your body, getting physical, breathing exercises, or progressive muscle relaxation, which is kind of another strategy, another relaxation technique. Acceptance strategies. What am I able to change in this situation, and what can't I? Right? Learning that early. And then, of course, communication, a language around emotions. There's the saying, you've got to name it to tame it, right? When we are feeling, sometimes children don't know what exactly they're feeling. They just know it's big. They just know it's uncomfortable. So helping them get detailed about what it is, giving them the words can be helpful. And assertiveness as well, getting their needs met, standing up for themselves. These are some kinds of, again, just some scripts about how to talk about anxiety to children. And again, I can send this out if we don't get to all of this, but anxiety can be a thought or a feeling that makes us feel nervous and uncomfortable. Our body sends us signals when we're anxious. Do you ever have a stomach ache? Anxiety is not a feeling that is going to hurt you. You are safe. You're just feeling your feelings. I think that's such an important message to send. Feelings are not dangerous, right? Feelings are not dangerous. And I think sometimes kids need to also know that. And also feeling alone with those feelings are usually what causes us suffering, right? But knowing that the feeling itself is not going to hurt us. Another one is, how we see the clouds in the sky. Anxious thoughts are similar. They come, they pass by. I think imagery works really well with children. You're not alone. Everyone gets these feelings sometimes, including me. Again, my kids love to hear stories of when I'm feeling anxious or sad. They really do I think are really, they listen in a different way when I tell those personal kinds of anecdotes. So when to seek further support. So again, I've said this over and over, if you take anything from this, it really comes down to when symptoms are interfering with daily functioning, right? If this doesn't feel like your child, your kid, trust your gut. If these symptoms seem to be interfering or there's been kind of a significant change, then it's time to kind of seek help. Talk to teachers, of course, or people who are with your kids in other settings, and see if they are experiencing, they share your concerns. And of course, I always also say to start with your pediatrician. You could speak to school counselors, of course, but pediatricians often have a kind of a process in which they can help you get that further evaluation. And it's so important if you are, unsure of what might be going on. It starts with a clear diagnosis. It starts with a clear picture and a thorough evaluation. I know it's a lot easier said than done. It's hard to get it's hard to get help sometimes. But we can't really know how to treat, you don't know what to do for your kid if you don't really understand exactly what's going on. So that thorough evaluation is really important. Speaking to other parents, there's a lot of online resources. And then, of course, taking care of ourselves. We are of no use to anyone if we're not taking care of ourselves. Self-care is a strategic parenting strategy, I'm supposed to say there, right? It is part of being a good parent. Children want parents that are fulfilled, and resilient parents raise resilient children. They need a sturdy leader, right, to kind of help them and support them. So we can do this by modeling the importance of exercise and sleep, the importance of real connection and socialization and putting the devices down, the importance of hobbies, interests outside of school or the pressures they may feel. Putting a prioritizing your relationships and your own mental health is going to only help you, support your children. So some mantras, as you can see, I think are also really important because in that moment where we're feeling overwhelmed and we don't know how to help our kid, I think it starts with kind of our own self-talk and making sure that we can kind of talk ourselves down and get to a calm place. So things like these feelings are present and they will pass just like a storm coming through. My calmness is contagious. Breathe, right? It's true. We kind of co-regulate with our children, especially when they're young. So if we are calm, that's going to help them learn how to be calm. My child loves me, and this is not personal. That's a good one. I do not need to be perfect. I am safe. My child is safe. I will respond with compassion and have compassion for myself. And I am exactly who my child needs me to be. So anything along those lines that you can access when you're really feeling overwhelmed is only going to help you more. So just to summarize, again, we want our child, the goal is for our children to experience the range of emotions and have the skills to manage them, not just to be happy and try to avoid all the other stuff, right? We really want to be able to arm our kids to be able to experience the range of human emotion and manage that. And emotional health requires practice, like everything that's hard. It requires practice. And there's gonna be practice, trial and error, and that's okay. If there's a significant change or interference with daily activities, seek further help, get that clear evaluation or clear picture, take care of yourself, know what you need, and then, of course, ask for help. So that is it. I have resources here as well and others if anyone is interested. I was going to do a quick mindful exercise or relaxation exercise for kids, but I actually realized we only have like 8 minutes, and I think we should probably let people ask questions if they have any. But if not, I can do this quick exercise. It's up to you, Marcia.
Um, let's see. Well, could you do maybe
It's
5 minutes?
yeah, it's super brief. It's really brief. And again, this is a mindfulness exercise for young kids. There are so many out there. That is one thing. I mean, the amount of resources we can find. I have here Headspace is an app that I use with my children. I absolutely love it. I think that, and they love it. And they're willing to watch the little videos and listen to the different imagery exercises. So this is a really kind of brief one, but again, what it's doing is even little kids can learn to help see how when they relax their body, it affects their mind. So this is called the chocolate body scan. So what you would say to them is first imagine that you are as stiff as a chocolate bar. Your whole body is stiff. Now imagine the warm sun is coming out. It starts to warm up the whole body. You're feeling very warm and your body starts to soften. The sun gets warmer and you melt like chocolate. Your legs melt like chocolate. Your tummy melts like chocolate. Your arms melt like chocolate. Your shoulders and neck melt like chocolate. And your face melts like chocolate. You feel so warm and relaxed all over. So and then you could ask, what they feel, if they feel any different from the beginning of the exercise. These are very simple, and kids usually really like them. And again, it's just kind of starting the process of helping them see that there are strategies to kind of turn the volume down for themselves or alter the way they feel. Okay. Any questions? I'm happy to answer.
Let me pull those up. What are some options for children when they are bullied? So specific options for handling it.
Well, I think, first, as I could go back to that slide, I think first reinforcing again that them coming to you is a first very good step, right? I think, you know, and again, including them in kind of options and what they think. And of course, this is going to depend on age, right? It's going to depend on the different setting of the school. And schools themselves, I know have very kind of detailed policies about bullying. So I think, again, trying to use whatever resources or, use the school as well, since you're unfortunately, as much as we'd like to be, we're not in the setting when this is happening, right? We can't physically protect our kid when it's happening. And so really help making sure you know, you're informed about what it is that's going on there, what the teachers or, the school is doing about it, listening to what they suggest. And really, I look at it like brainstorming. So that might mean, I mean, again, it depends on the situation, but finding out if it's happening online, for example, limiting, if it's helpful for the child to limit that, to again, find out which friends are at that do support her. So I think it's going to depend, and I wish there was one clear answer, but I really would try to use this school. Hopefully, they are a partner in this and can help with suggestions.
Does Capitol Health offer psychiatric appointments other than the emergency services?
Yes, so we do. We have psychiatrists in our outpatient behavioral health locations. And so you can, if you're looking for outpatient, you can call and make an appointment with a psychiatrist. Um, Typically, you can it's easier to get an appointment with a psychiatrist for an evaluation, and then there are therapists, and there is sometimes a wait list for the therapists. But we will also refer you to other therapists if we can't help you here.
What physical symptoms may occur with depression and anxiety beside GI?
Oh, I think it can be well. So part of panic disorder, for example, which is an anxiety disorder, it's a lot of physical symptoms, right? It's shortness of breath, numbing. You can feel a rapid heartbeat. So that it can be a very physical situation, a very physical experience. And, so that in and of itself would be some symptoms. In addition, I think for children, besides GI, I think you can have headaches. There can be headache complaints. Again, fatigue or restlessness, those types of things. So it really depends on kind of what again, the baseline of your child. If all of a sudden your child is complaining of a lot of physical things, of course you're going to rule out any actual medical issue. But if that after that, and there's still kind of a pattern of these complaints, you could consider that it might be part of some anxiety or depression.
How do you deal with teens that are absolutely adamant about not participating in an activity for the fear of the unknown?
Mm.
Let it be, or kind of force the situation so they see that it's not scary?
Oh, that's a good question, right? That's kind of a constant, I think, line we walk as parents, which is how much do we kind of push and force because we think on the other side of it that they could maybe learn to like the activity or learn a lesson of commitment, all those things, rather than kind of trust what they're experience, trust what they're saying and what they want or don't want to do. I think, again, it's going to depend on each child and kind of kind of what their tendencies are. But I do think going back to that trusting your kid, and encouraging them to trust themselves, I really think that's important. I think that there may not be that much benefit to pushing your kid to doing something. I mean, I kind of am of the mindset if they're gonna love some activity, they'll find their way to it. You know what I mean? I think kids are inundated with trying out every single thing, and kind of finding some sort of passion at age 8, which is completely unrealistic and not that healthy, right? And certainly wasn't the way that most of us grew up. So I think kind of putting the brakes on that kind of urgency to pushing them into something is okay. I mean, certainly you can have a conversation, you could, try to encourage them to try it. And if they don't like it, then they don't have to. But I do really think kind of reminding yourself that, you're, especially if they're a teenager, trusting that they know what their interest is. You mentioned that I didn't get to this part, the fear of not knowing, that kind of has another element or layer on it, which is that is the anxiety interfering or the fear interfering with trying things. And that might be something to address a little, kind of more in depth, right? Asking questions with true curiosity. What is it that the fear is? Is it fear of evaluation? Is it fear of failure? Is it fear something's going to happen? So getting kind of more information, I think, is a good start as to what the fear is.
Any helpful tips on how to deal with belly aches due to anxiety?
Oh, well, I think, but first off, providing validation and, kind of, I think this was on that anxiety here, you know, anxiety it's not, can cause actual GI discomfort, right? So it's not that I think sometimes we think, oh, they're just, sometimes parents want to kind of dismiss these symptoms, but it could be that there is real, kind of stomach discomfort due to it. And also validating that it's very normal if it is due to anxiety. So I think kind of helping, again, cope with the anxiety part, right? Which is maybe using some of those kind of emotion regulation skills, mindfulness skills to turn the volume down, right? If and kind of seeing what the patterns are. Is the anxiety when we go to friends' houses? Is it when you go to school? Is it when you separate from me? Kind of again, really looking at when this happens, and then are there other strategies to help reduce the anxiety, and then maybe that will, reduce the GI discomfort as well.
I don't see any more questions. So I guess that will be it. Thank you very much again, Dr. McGuire. Really nice job. And we had a lot of good questions. So you piqued their interest, and I'm glad people felt free to ask and share. Again, we'll have the recording available probably in a week or two. And I will stay around here now for a little bit so that you can complete the evaluation, which I just put in the chat box for you. And I guess that's it for tonight.
Okay.
So thank you
Thank
very
you.
much.
Okay. Thank you.
Have a great night.
Bye.